The frontal bone, a protective shield, structure and function. The frontal bone is a crucial component of the skull, forming the forehead and contributing to the structure of the eye sockets. It's composed of the squamous part, which is the prominent curved portion that makes up the forehead, the orbital part, which forms the roof of the orbits or eye sockets, and the nasal part, which contributes to the upper part of the nasal cavity. Key features and landmarks include the glabella, which is the smooth prominence between the eyebrows, the supraorbital margins, which are the bony ridges above the orbits, and the frontal sinuses, which are air-filled cavities within the bone that reduce skull weight. Additionally, the coronal suture connects the frontal bone to the parietal bones, and the metopic suture found in infants is a midline suture that usually closes by age 2. Clinical significance. The frontal bone's location makes it susceptible to injuries. Fractures can lead to severe headaches, visual disturbances, sinusitis, and even leakage of cerebrospinal fluid. Understanding the anatomy of the frontal bone is essential for medical professionals, especially those involved in trauma, neurosurgery, and otolaryngology.